So continuing top 10 important point from 28th edition of Delhi. Today we'll talk about mammography. So mammography and ultrasounds are first line investigation for imaging the breast. It is used as an initial screening tool for asymptomatic women in population-based program. So in population-based program, mammography used as the initial screening tool. Okay. So it is a type of X-ray in which we use low voltage, high amperage. Low voltage, low, and so low voltage, high amperage, and the radiation dose is 1 milligram per film. Just remember 1 milligram. Okay, and it is a first line investigation in older women for breast symptom. Okay. So on mammography, if patient present in an advanced case, you can appreciate ancillary signs of malignancy. So what are the ancillary signs of malignancy on mammography? Lymphadenopathy, breast edema, and skin and areolar thickening or retraction. Okay. So mammography and ultrasounds are just a first line investigation. They are not the diagnostic. So biopsy is required for definitive diagnosis in Byrad score 4 and 5. We will discuss Byrad. So this is the two plane mammography. So the first one is mediolateral oblique view, and the second one, this one is a craniocaudal view. Okay, so this is normal mammogram. Now we will see the Byrad score 2. So in you get picture and they will ask what type of Byrad this is. So this is 2 because this is cyst and internal echoes and floating debris. You can appreciate this debris and all. Okay. So the next one is a fibroadenoma, and fibroadenoma comes under Byrad score 3. Okay. And the last one is Byrad score 5. In Byrad score 5, you will see a solid irregular shape mass and taller than wider. This is important one with angular irregular margin. So this is Byrad's 5. Okay. Now we will see Byrad's. So full form of Byrad's is breast imaging, reporting and database system. Okay. So we divide Byrad into 0 to 6. So 0, in 0 assessment is incomplete. So you have to go for additional imaging or you can refer old mammogram just for comparison. Okay. Now Byrad type 1, category 1. In category 1 and category 2, the 0% of probability of malignancy. 1 is negative, 2 is benign. Okay. So, or in 1 and 2, you have to do annual screening mammography if patient age is over 40 years. Okay. Okay. Now come to category 3 of Byrad. This is probably benign. Okay. So if there is probably, so chance will be less than 2%. Benign 0, probably benign less than 2%. And since it's a probably benign, so you have to reduce annual mammography to 6 monthly mammography, and there is no age bar in this group. Okay. Okay. 6 monthly, no age bar. Okay. Now come to category 4. In category 4 of Byrads, there are 3 types: 4A, 4B, 4C. In 4A, A is, just remember, A is 1. A is 1. So Barrett 4 is at 10, less than 10%. Okay. So low suspicion. Okay. Low, low suspicion. Okay. Okay. And then Barrett B is intermediates in between A and C. So intermediate. So B will, the probability of malignancy increase from 10 to 50%. So B is, just remember, 50%. Okay. And C is moderate concern. Finding of moderate concern with high suspicion of malignancy. Okay. High suspicion of malignancy. High suspicion of malignancy. Okay. Okay. And the probability of malignancy is less than 95%. Okay. Okay. Now come to Barrett's 5 and 6. The 5 is highly suggestive of malignancy. So 4 shows high suspicion. If word comes as a suggestive, so it will be 5. So highly suggestive of malignancy is Barrett 5 and probability of malignancy is 95. Just remember 5 and 95. 95. Okay. So in Barrett's 4, you have to do biopsy. In Barrett's 5, you have to do either biopsy or surgical treatment. And Barrett's 6 is a biopsy proven malignancy. So biopsy already done. So what? And so you can do a lesion identified on imaging study with biopsy proof of malignancy prior to definitive therapy. Okay. So mainly surgery. You in Barrett 6, you mainly you have to do surgery.